Don't forget to like, comment, and subscribe for your regular dose of Asian health information.
Someone has a resting heart rate of about 70, which is considered like a normal heart rate. That's great, you know. So that's a normal average heart rate, which shows that the individual probably is quite relaxed and the heart rate is not fast. That's good. Blood pressure, systolic blood pressure, that means the high number of about 110, 120 is fine. But if it's more than that, then you're starting to move towards borderline high blood pressure. Okay. So fasting blood sugar levels. If you use the millimoles, then less than 6 millimoles is considered normal. So someone with a blood sugar level about 5 plus is quite normal. But that's fasting. So sometimes after a meal, it can go up a little bit. It's okay. You know, you don't have to be so paranoid that the sugar level has to be always 5 or below all the time, right? So these are some very simple ways that you can know that you're all right, your body's on track. What advice would I have for someone, regular guy who's stressed up, working very hard, eating all kinds of crap, calling up for delivery service, for food? The first question I always ask them to ask themselves is, sit back, think about it. What do you really want? What are your goals in life? What do you want to achieve? What are you doing all this for? You know, don't get sucked in because your buddy's doing it or your boss asks you to do it. You need to sit down and you need to think. In Singapore, we have reached a certain standard of living, which is like, you know, like Western standard of living. You know, we're not tilling the soil or scratching the bottom of the barrel like what's happening in a lot of countries in Asia. So we really do need to sit back and think and ask ourselves, what do we really want? And that's important. Set some goals. Okay? If time is important, you want to spend some time with your family and your wife, your kids and all that, then that needs to be a priority. You know, so things like that. We can always work harder. You know, there's no need to walk out to the coffee shop to eat if you can get delivery. But you can also cook your own food, right? It just takes a little bit more time. But to make it fun, maybe you do it with a friend, you do it with your kids. So make the whole thing a family kind of a routine, a family thing. You know, something that's meaningful to you. And if we are clear what our goals are, then it becomes very clear what we need to do. You know, so many people come to me and say exactly that. I don't like to run, I don't like to go to the gym. So the simple thing that I ask them to do is, what do you like? You need to sit down and figure out what you like. Because if you don't like something, you must like something else, right? There's always things to do. For example, you know, I just read today, someone said Pokemon Go keeps him fit because he plays Pokemon Go, so he goes here, goes there, goes everywhere to go and hunt these Pokemons. You know, nowadays I go to some place, I come out of the bus stop and I see a whole bunch of people standing around there, it's Pokemon Go. So I'm not, you know, I don't know what Pokemon Go is all about because I don't play it, but I have friends talking about it. So if you like that, you know, that gets you out. Then you just play your game because what you do is what you like, right? But along the way, you're doing something that's getting you out of the house, getting you moving, right? So this is important. Not everyone has to run, not everyone has to go to gym, not everyone has to kind of lift weights and that sort of stuff. We can do other things. Healthy, active lifestyle has to include essentially a lot of activity. I always tell my patients, we are humans, we are animals, we're not plants. The difference between animals and plants is that animals move. So if we don't move, then you got to ask yourself the question, why aren't you moving? What's wrong with you? Are you unfit? You know, I give you something very simple. I always ask people, can you squat or not? You know, people say, oh no, I can't, my knees like this and that. I said, do you know that one generation ago, if you couldn't squat, you couldn't go to the toilet, right? Because that's how you went to the toilet and everybody squatted every day, several times a day. You know, I always remember when I was a kid, my grandma told my dad when he was renovating the house not to renovate her toilet. because she needs to squat. And this old lady has to squat to go to the toilet, and it was a normal thing for her, you know. My point is that there are a lot of things that we used to do as a matter of course, matter of routine, which people have stopped doing. So just get out there and move. Do whatever you enjoy, but you got to do. Yeah?
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.